Let's talk about symptoms and disorders. The first step you should take to understand any TMJ problem that you may have is to know the difference between symptoms and disorders. Let's start by looking at a serious infection. This lady has a very serious facial infection. She is having obvious symptoms from underlying disorders. She has pain, swelling, and she has a fever. She has limited jaw opening and is having difficulty swallowing. Those are the symptoms. The disorders are an infected wisdom tooth that produced a large abscess that irritates the swallowing and jaw movement muscles. The treatment is to correct the cause, that is, remove the tooth, drain the infection, and use the proper medicines, including antibiotics, to help her return to health. In summary, the disorders are an infected wisdom tooth and associated abscess. The symptoms are pain, swelling, fever, limited jaw opening, and difficulty swallowing. Symptoms are what you feel, and disorders are what cause the symptoms. Now let's consider TMJ symptoms and disorders. Here are common symptoms of TMJ disorders. Please note that these are descriptions of symptoms and tell us very little about the anatomic problems that cause the symptoms. TMJ symptoms occur because of anatomic and physiologic problems, generally called disorders and deformities. Symptoms occur because something is wrong with the underlying anatomic structures and the way they work. Here are common disorders that cause symptoms. Disorders and deformities cause TMJ symptoms. This is important, so I will say it again. TMJ disorders and deformities are the cause of TMJ symptoms. Common TMJ anatomic deformities and misalignments include torn ligaments, dislocated discs, and arthritis of the bones. Why is it important to know the difference between symptoms and disorders? Because treating only the symptoms may make you feel better, usually just temporarily. But if you really desire to get rid of your TMJ problems, then the underlying disorders that cause the symptoms must be identified and corrected. Intracapsular pain occurs within the TMJ in front of the ear, and it is usually from strain, sprain, and swelling of the ligaments and other tissues within the joint. Myofascial pain occurs within the jaw muscles along the sides of the jaw, temple areas, and the side of the head, and occurs as a response to intracapsular pain and instability of jaw position. That is, the muscles become overworked from trying to position the jaw into a comfortable, stable position that cannot be found. Overworked muscles produce lactic acid and become fatigued and hurt. The body may compensate for the overworked muscles, often by recruiting other muscles in the neck, shoulders, and arms. This is how TMJ pain can result in pain in these other areas. To be fair, there are many causes of headaches and muscle pains, and it is not uncommon for a person to have multiple types of headache pain, such as TMJ-related pain, upper neck pain, and migraine headache pain at the same time. These combinations of symptoms are often very challenging to diagnose as well as treat. Are the treatments you are considering or receiving focused on managing your complaints, that is the symptoms, or are the underlying causative disorders being diagnosed and treated? An injury to the jaw causes compression of the tissues within the TMJ, resulting in pain, limited jaw opening, and it is difficult and painful to chew. The injury causes sprain and swelling within the TMJ. Treatment may be as simple as avoiding chewing, jaw rest, and using acetaminophen and ibuprofen to provide comfort and allow time for the injury to heal. In this example, treatment of both the symptoms and underlying disorders is with medication and jaw rest. Most TMJ disorders are more complicated and involve problems not just within the joints, but also with the way the teeth come together and the alignment between the upper and lower jaws. Misalignment of the bite and jaw bones often results in damage to the ligaments and discs within the TMJs. For example, pain in the TMJs and muscles may occur because of damage within the TMJs, but the source cause of these issues could be from a bad bite. Managing painful symptoms with medications, night guards, and splints, and other forms of treatment usually cannot be successful in the long term because the underlying disorders have not been corrected. Stated another way, disorders of the bite, bone alignment, and TMJ structures cause symptoms. The symptoms result from structural, anatomic, and physiologic problems. That is, disorders are the cause and symptoms are the effect. So now you know the difference between symptoms and disorders. So if you're receiving treatment for TMJ issues, is your treatment managing the symptoms, or is it correcting the underlying disorders and deformities causing your symptoms? Sound confusing? It may seem so at this time, but by learning facts about your TMJs will help you understand how your jaw should work and what disorders you have that are causing the symptoms you are experiencing. Check out my other presentations. The next one you should view is about TMJ anatomy.